Well, one of the things that I think you've put more attention on in the last few years is where patients' focus is.
Yeah.
And so the patient with chronic pain focuses too much on the back pain, and so the back pain gets worse. The patient who has an anxiety disorder focuses too much on the experience of anxiety.
Right.
And then the anxiety gets worse.
Well, I'm glad you mentioned that because I left out a key part of the theory. Okay, so focusing is a key part of the theory, and this has come in fairly recently as a major part. So people have said, well, how do you... So sometimes like this morning, I was doing a supervision call with some therapists from New York State who are working with homeless veterans. And they start telling me the case, and I get a formulation. I mean, within 5 minutes, I come up with a formulation. And this is the formulation thing that I follow. First of all, I have to try to discern what is the belief that's behind this particular problem, what is the behavior that's behind this problem, and what is the kind of focusing that the person is doing. Now, once you have this triad of what I've said, the belief, the behavior, and the focusing, it can give you a thumbnail sketch so you can address it to any particular problem. And I would love to have the people in the audience tell me some kind of problem, and I could show you just how I would make a guess. And incidentally, I didn't have to invent all of this, but practically every disorder that you know of has now been investigated by people who have now found out what the basic belief is, and we know by the diagnosis what the behavior is, and then you add to that the focusing. So what's really idiosyncratic, what's very specific and unique to every condition, every problem, is the belief. There's some overlap in terms of the behavior, and every one of them has the focus. So if you take depression, for example, and let's say there's a loss, so the person may be focusing on the girlfriend who rejected the guy. So there's a focus on that, and the mind is going over and over again. There may be a focus, the person feels sad, so the patient focuses on the sadness, and then that magnifies the sadness. The person then feels kind of fatigued and feels like withdrawing and focuses attention on that. Then there's beliefs that come into each of this. So when the person withdraws from other people, this may stimulate the belief, I just don't have the energy, I'm weak and helpless, I can't do anything. Or he may focus on the rejection and have the belief, my whole life is ruined, I might as well kill myself. So when you get this triad, you can kind of get a little thumbnail sketch of every single problem and disorder.